Good evening, everyone. I'd like to call to order the November 26, 2024 CMH Full Board Meeting. Please stand for the pledge.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next is the reading of the mission statement by Megan.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provide quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is adoption of the agenda. I'll take a motion to adopt.
Support.
Motion from Mark, support from Selena. Yeah. Any comments or questions? All right, all in favor say aye. Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Just give us your name.
No, go ahead.
We'll arm wrestle.
Rock, paper, scissors. I can't arm wrestle.
Bruce gets to be the referee.
Good evening. May it please the board. And I just thank you for the time to introduce myself. My name is Chandra Kozard. I am the incoming Chief Compliance and Privacy Officer. Just a bit about me. I am a licensed attorney. I have been licensed for about 20 years. I also have approximately 15 years of cross-functional experience with a focus area in compliance. And in the upcoming weeks, you will receive an email about future compliance committee meetings to support our program integrity requirements. So thank you very much, and I will yield my time to the other public members.
Thank you and welcome.
Greetings, good evening. Bruce Dunton, Director of Crossroads Clubhouse.
Angel Weiss, member of Crossroads Clubhouse.
So every year, right around this time, we like to come to the board meeting and present our annual quality outcomes. And so we want to present those to you tonight.
Thank you. Crossroads Clubhouse membership has 95 members. Average daily attendance is 27. Total attended, 6,663. Holidays celebrated 12. Virtual participation 177 times.
Our average unduplicated monthly sign-ins, this is for individuals that are coming in, that is 74. That means that 78% of those 95 members are coming in on a regular basis. For the meals that we provided in 2024, we provided 4,862 meals. Our average monthly meal was 429. As Angel said, we did 12 holiday dinners with 213 members participate or attendees for those meals. And then we provided 64 free meals for 2024.
We've had 58 tours with 25 new orientations. That is a percentage of 50%.
For hospitalizations, really cool thing. One of the things that we're really proud of is the fact that it seems like those who come to Clubhouse on a regular basis don't really spend a lot of time in the hospital. And so for hospitalizations this year, for those individuals that went into the hospital for behavioral health reasons, a little over 1 per month, for a total of no more than 15 days. On the contrary, for those individuals that went to the hospital medically, it was about 2 people per month that went into the medical hospital, and their days of stay was about 18. We have what I consider to be just a fantastic community outreach. We do a great job in that. So the total number of cards that we mailed out for 2024 was 866. We made over 1,000 phone calls to individuals that we hadn't seen come into Clubhouse. We made 9 house visits. We participated in 21 community groups. That means any opportunity that we had to get out there to share information about not just Crossroads Clubhouse, but the Clubhouse model, we went ahead and did that. Newsletters, on average, 780 newsletters we send out a month. That's a little over 9,000 for the whole year. Emails, which is mostly emails to members, staying connected with them, that is 178. Social media. Social media has been really, really great for us. We have a really, really fun Facebook page for those of you that don't participate in it. Please make sure you do. We have a lot of fun doing the news beats, poke a lot of fun. We have a lot of bloopers.
Waiting for the bloopers to come out.
I think most of the bloopers are me, which I'm glad that I can spend the time making fun of myself.
That's all right.
Yeah. So, social media. Go ahead.
Okay, members enrolled in school are 3 at this time. We assist 4 members with housing. Transitional employment, right now we have 4 spaces. Supported employment in MRS, which is Michigan Rehabilitation Services, is 4.3. Independent employment is 9. Sheltered workshops is 1. Percent of members employed is 26%. Total TE support time per hour for hours is 14 a month. Total supported employment time in hours is 3 per month. TE staff coverage was 15 hours a month. TE shifts coverage was 2 shifts per month.
One of the things that we spent a lot of time improving is our employment and education. As a matter of fact, we took one of the rooms at Crossroads Clubhouse and dedicated it solely for employment and education. That means that any clubhouse member can go into this room, do a resume, do employment search, anything related to employment. That room is dedicated for that. In addition to that, that room can also be used for education. So if you're going to school and you need to do homework, then you can go into that room and focus on your homework. You can do homework research. You can do any type of homework that needs to be done in there. So for last year, the employment, we call it staging. That's conversations, talking to people about moving into an employment situation, whether that be TE, supported employment, or independent employment. We had an average of 17 per month. On our education side, we have some retired school teachers that come in every Tuesday and Thursday and provide all kinds of different aspects of education. So you could be in Europe today, you could be in California learning about government next week, you could be in another part of the world learning about something else that's happening in a different part of the world. And that average there is 17. For our wellness, one of the standards is really talking about improving overall wellness for those individuals that participate in a clubhouse model. So on average, we had 17 individuals that were participating in our wellness program. We go for a 1 mile walk every day. That means for the whole year, I think we walked 201 miles for the entire year. And for those individuals that are participating, 63% of the average daily attendance participated in our wellness program.
Now comes the really fun stuff. We go on a lot of social rec activities. And this year we've done 162 for the 2024 thing with an average monthly social rec attendance of 44. So of all the, the 78, 77 that come, 44 of them have attended a social rec event.
For units billed for psychosocial rehabilitation, that billing code right there, we've accounted for 119,231 units that we've billed for 2024. Transportation assistance, we've really ramped up our transportation. I think that we can get better if we had a vehicle that could accommodate those individuals that have a really tough time getting in and out of the van. But it's on average, for a total, it's been 106 people that we've helped with transportation, getting back and forth to clubhouse, or getting back and forth to work, or providing transportation for social rec activities. Our website, we just launched our website at the end of 2023, and then in 2024, it's really kind of blown up for us. So our website, we've had visitors that have happened 8,681 times. So at Crossroads Clubhouse, we're having a lot of fun right now, doing a lot of great things, improving it. We do have our accreditation visit next Tuesday, Wednesday, and Thursday. So Wednesday is the closing summary. We've invited Tracy and Libby Bucci. I'd love to have Phil Kraft come and join us for the day. That'd be absolutely awesome. That happens at 10 o'clock. That will be available Zoom. So for those of you that can't be there in person and want to participate with us Zoom, you're more than welcome to listen in on those closing statements. So thank you, and we appreciate you continued providing support for Clubhouse and allowing us to do what we like to do. Thank you.
Thank you.
Thank you both for the report. Great work as always. Is there anybody else from the public wishing to speak? Anybody else? All right, seeing none, we will close the first hearing of the public. There is another opportunity before the end of the meeting, and we will move on to item 5. I will take a motion to approve the minutes of the CMH full board meeting held on Wednesday, October 23rd, 2024, and the minutes of the CMH special full board meeting held on Tuesday, October 29th, 2024.
Support.
Motion from Selena, support from Lori. Comments, questions, changes to the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are approved. Next, I will take a motion to approve the minutes of the CMH Program and Budget Committee meeting held on Wednesday, November 13th, 2024. Motion from Mark, support from Donna. Changes, comments, questions? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. And now we'll move on to item 7. I will take a motion to approve items A through I. All of these items were discussed at program and budget this month. Motion from Megan, support from Selena. Were there any other last comments or questions on any of these items? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Congratulations, Tracy. TJ, you have your orders. Next, we'll move on to item 8, receive and file. We have no items there. Item 9, resolutions, no items there either. Item 10 is the voucher listings. I'll take a motion to pay the bills.
Support.
Motion from Selena, support from Lori. Comments or questions on the bills? Hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Now we'll move on to management report, and we will start with Tony with the CFO update because Ken and Richard are not here. So Tony's the man tonight.
Is that on? Okay. Well, good evening. What we're going to do is present September financials. Now, what we're going to look at, I think this is on page 87 on your packet. These are based on our interim FSR, which was due to the state a couple weeks ago. So these numbers that you're going to see today are subject to change as we work through our final FSR. That will be due in February. So there are, adjustments and other things, accounting related and claims related that'll come through between now and then. So I would consider these our first draft or interim September financials. A few things I do want to point out as we work through our interim FSR, where we're currently at with our lapse is we're estimating about 5.5 million, but again, subject to change, but that's what we're expecting at the moment for 2024. And then we're expecting about 19 million to be added to savings. So again, we'll present those final numbers once they're presented, completed, but that's what we're looking at right now. The other thing I wanted to make the board aware of is we're currently working on our risk management strategy. That will incorporate our risk report as well as an updated ISF report. So we're working through that. It's going to be due to the state next week, and then we're going to bring it to the board at the December meeting. So we'll have the opportunity to review that and to ask questions related to that. Okay. Going into the financial packet, this is page 88 in your packet, looking at the revenue and the eligibles. Again, things have stabilized. We had obviously some changes towards the middle of the year, but here, as we get now towards the end of the year, both revenue and eligibles have stabilized. We're not expecting any big changes in any of those areas. If you turn the page 89, I just wanted to point out a couple things there. If you look at the asset graph, you'll see in the blue under cash and investments, 277 million. And just a reminder to the board, that is before we sent the settlement payment to the state. So the next time you see these financials, the asset and investment will be at least $62 million less. But that also correlates to the liabilities. If you look at the 85 million that is in the middle chart, in due to state, that will also be reduced by the 62 million. But that was paid in October, so it'll be represented in the next financials. So nothing else really to report on that page unless there are any questions. Okay. I was going to go ahead and skip to page 91 and just point out a few things here. The first, if you were to look at the Medicaid and the Healthy Michigan, the $28 million surplus against the 1.1 million deficit, but we have a net surplus between the two programs at 26.9 million. Looking at the CCBHC Medicaid and the Healthy Michigan, the $8.6 million surplus and the 2.7. So we're expecting the net surplus there to be 11.4 million out of the CCBHC. And if you go to the bottom of the page to the lower right, our risk reserve currently stands at the $46.1 million, which is what we have been presenting all year based on the most current ISF. That is the number that will change the next time we present the financials with the updated information. And if you turn the page to 92, just a couple things to point out there. I was going to take you to the state general fund where you look at the redirects, that $4.1 million, looking at that continued expense that we're having with the non-Medicaid. So we expected that. It was trending up and it's come in at about $4 million so far through September. And then the final number that I was going to highlight is just under the all other. If you look at the 9.7 million surplus, that's a combination of the CCBHC earnings coming through as well as the interest earned on the investments and excess PA2 funds. So that also is reported in a surplus. And then the final page, 93, just looking at the balance sheet, again, nothing major to report here. It's just those items that we looked at in the graphs in terms of the assets, and the due to is going to go down by that $62 million payment. That will also impact the balance sheet the next time we look at it. But other than that, no material changes expected in that report. The balance of the packet is just presentation. We do present the county and SUD separately. Unless there are any questions, I wasn't going to go into that detail. And then the last 2 pages, just a summary of the payers that we pay. So I know that was pretty quick and there's a lot there. Any questions that I can answer?
Any board members with any questions? Just a quick note from the county's perspective, the county budget was approved and there were no changes to our portion of the county budget, so that remains the same. But other than that, I don't see any other questions. Thank you, Tony.
Thank you.
Next, we'll move on to Tracy with the CEO update.
Thank you. I do want to draw attention that earlier today around 4 o'clock, I did send the board report. If you haven't checked it out, that's probably going to be your best source. As you know, we have some very complex things occurring in our world, and I would really encourage you to read through all of those materials. I would just draw extra attention to DAB concerns. As Tony mentions, it's somewhat leveled out, but there's concerns at the state level, including affecting us of inaccurate enrollments. And it's been backtracked, and just to give you the spoiler alert, it's estimated to be about incorrectly funded by about 500 million statewide. So it's a huge impact. The second one is the HAB waiver. So HAB waiver, we've been not trying to simplify this. There have not been payments for every HAB waiver. HAB waiver, we get paid at a different rate than we do for others. So we've been submitting data over the last 6 months, give or take. In a 6-month period, it causes a lack of proper funding due to the proper methodology of about $500K every 6 months. So just to kind of draw your attention to those outliers, because there is a concern that is there a pattern of error in this, and what can we do to draw attention to it to ultimately try to fix it and make the system better, of course. The second thing is a little bit more exciting. Is in front of you have a little chart, if I can draw your attention to it. As we've discussed in the past, transportation is a major challenge in Macomb County for
anyone who doesn't own their own vehicle or have a person that owns their own vehicle. So we know there's limited transportation. So as stated before, in 2025, we're taking on this challenge. We are not going to be the transportation solution because that is not our job, but we are really trying to be interact with the rest of the community and figure out where are their problems so we can help try to address them. And ultimately, our motive is to help the people we serve. So what you're looking at in front of you is you have I'm going to start with the top one. It's the green and the blue chart, just to give you kind of a premise, because the next resource I'm going to tell you that you will care about it. It will make sense once I explain. So if you looked at who we served last year, the green is people who reside in Macomb County, which would make sense, 95%. You do have 4% live out of county. I counted that if it was St. Clair, basically anywhere within the surrounding area. And you do have 0.08% out of state. Just to further explain, that would be because maybe someone is in a specialized residential facility or something like that. So the people who are outside of our county, they're still ours, right? But maybe they've been placed somewhere or they're temporarily in a different location for a reason. So that's where they reside at this moment. The bottom chart, though, we only have 15% of our population that we served last year are 55 or older. So the reason why you care about that is on this next little resource that I'm giving you, we told you that one of the next resources that we're going to look into transportation is senior services. And what's really, really cool, what I just said is true. But what you're looking at is city by city. So when I say city, if you go all the way over to the left, if you notice, it goes Armada Township, Armada Village, Chesterfield Township, right? Do you see how it's going through that? Every city has either a free or a very low-cost transportation assistance to someone to get to and from. That could be appointments. Some of them it's grocery stores. Some of them it's the airport. This chart you see in here has city by city, very specific information. I'm going to take Armada Township as the first example. So in Armada Township, if you go to the first light blue section, it says who is eligible, a resident. That's it. So we started down the road of like what senior services are available, and the reality is we discovered that it's not about seniors in most of these communities. It's just if you're a resident. Then if you notice, it talks to you all about the details, like when's it available, how often, or when do you have to call to get to them ahead of time. It gives you if they're closed on holidays. It gives you also their boundaries, right? So in other words, where do they drive through? And I think you'd be pleasantly surprised the boundaries. What I'd also like to draw attention to is you have all these cities, but it'll be odd for you in the way that you have the list. I think several of you are familiar with the Richmond-Lennox collaboration. So with that collaboration, it's a group of local cities. I don't remember the total off the top of my head, but they are listed in here. All of them basically collaborated together with their smaller funding sources, and all of them provide free transportation to the residents to and from appointments or whatever it is as outlined on this chart. They have a success rate of 93%. What I mean by success rate is they say that if you call and ask for a ride, that 93% of the time we are going to be able to get you on that ride and get you to that location. Now they do have boundaries, but what's very, very cool, the boundaries are huge. So it's not like they're only transporting you in Armada Township, right? Because it's a collaboration, you basically have the majority of northern Macomb County. And the example being, they go as far west as Beaumont Hospital. So technically Beaumont, as we all know, is Oakland County because it's on DeQuinder, right? It's across the street. But they will do that, and they will do far south for some of them as, forgive me, they just got sold, so it confuses me. Ascension Hospital downtown. I get like, what's their name? Thank you. Give me credit. It changes it frequently. What used to be known as, right? So I give you that as, you know, that's in Wayne County, right? So they really do go outside of it. And what's very, very great, cool about it is they really do base it on the needs, right? So those examples of people of real life visits at those hospitals or specialty services or whatever it is. So I think, I'm hoping you're pleasantly surprised about what exists. Now, we know they can't do this hundreds or thousands a day. So there is some limitations here. But remember, I gave you the Medicaid health plans have what they can potentially do or have the potential resources. This will be a second one. And basically the goal would be every month to 2 months to bring the next level of thing. And if you visualize this, you have a tab, right? So you'll have like all these different resources and they'll be clearly labeled so somebody could go city by city. That's what this one is. Free transportation or greatly reduced transportation services. And again, just as a friendly reminder, the long-term goal is not just to develop a tool to be helpful for our community, but we want to absolutely better understand the gap so we can better advocate, right, Phil? So when you call SMART, you'll know exactly what we're asking for. Great, that's all I have.
And to piggyback off that, I actually met with the director of the Richmond Lennox EMS last week to sort of start that discussion and talk about their relationship with Smart and everything that was going on. And he said that they're at 93% because they're so busy that they have to sometimes turn people away because they are already booked because they only have so many drivers, they only have so many vehicles, and that's really what it is. He's striving for 100%, but there's only so many people, so many drivers, so many buses. So so we're working that piece, and hopefully they can be a great asset for us further down the road too.
Yes, for sure. That's
all
all,
right.
that's
That's
all
all
I have.
Okay, perfect. I only have one thing. Dana from Oakland contacted myself and Tracy last week. Their board chair put together a letter to MDHHS, to Elizabeth Hertel, asking them to release the other 53 million has not been released yet to the PIHPs, and asked if I would sign on to it just as the board chairs. So I agreed. I said, this one's not our fight. We're okay right now. I said, but we have several other fights and we could use some teammates. So I think this is going to hopefully spark that conversation, at least between Oakland and us. I have not heard what Wayne's chair has decided to do yet, but 2 out of 3, if that's what it is, ain't bad. So that's all that I have as well. Do any board members have any other comments or questions for Tracy or myself? Okay, perfect. We'll move on to some reminders. We do not have program and budget in December. We will have one full board meeting, and that will be December 18th at 6 o'clock here. We also have a recipient rights advisory committee meeting Thursday, December 12th at 8 a.m. at our administration building. And with that, we will move on to the second and final hearing of the public. Anybody from the public wish to speak? Anybody from the public? Okay, we will close that, and I'll take motion to adjourn. Motion from Megan, support from Lori. All in favor? Aye. We are adjourned. Everybody have a safe and happy Thanksgiving. See you in December.